For what purpose does the gentleman from New York rise?
To strike the last word in to respond to the gentleman's amendment.
The gentleman's recognized.
Thank you very much. And I'm a big fan of Mr. Whitfield, but he missed the big thing here, and that is we're in the portion of this budget where the legislative branch is funded. Isn't this the opportunity to end the funding for the health care plans that so many members of Congress get? So many members of Congress get health care plans like the 9 million federal employees and their workers, where they get a booklet twice a year with different choices, and since there's so many workers, they're aggregated together to be able to hold down costs for all of them. This is exactly what the new health care plan that is going into effect for the American people seeks to do. Now, the Democrats have said, let's extend that to all Americans. Let's give everyone that opportunity. And my Republican friends say, no, that's government-controlled health care. This is your chance. Don't blow it. Mr. Whitfield's an important, prominent member of the Energy and Commerce Committee, one of the most learned members of that committee. This is our chance to say, you know what? We're so against government-run health care that we want to get rid of the Federal Employees Health Benefit Plan. This is your moment. This is the time. Let's do it. Come on. Let's put your money where your mouth is, Madam Chair. I mean, the problem is here that if you think about what's going on with all of the debate about health care and the big government-run health care plan, it's really not that. It's really taking the number of uninsured people, giving them subsidies and incentives to go out and get private insurance, and then since more people are going to have it, all of our costs come down. The aggregation that goes on in insurance markets and automobile insurance, for example. And members of Congress take advantage of that. Now, I should point out the mythology that there's some fancy health care plan. No, we're in the Federal Employees Health Benefit Plan. We get this booklet that we get every 6 months. We choose the plan that's best. It's like the exchange is going to be in 2013 and 2014. And so here it is. We're on the floor. This is your opportunity, and I respect Mr. Whitfield's. I don't know much about this provision of what coal-powered plant there is here, but I do know that's here. Why don't you step up and say we're opposed to government-run health care for members of Congress? You know, it was funny. There was a member of Congress on the Republican side, and I forget his name. You'll forgive me, who campaigned all summer and fall against what they call Obamacare and how outrageous it is. It's going to get to work on doing away with it. And they had orientation for the new members of Congress. And he stands up and says, when do I get my government health care plan? And when we started looking and we started asking questions, it turned out that there are a lot of members of Congress who rail against other people getting health coverage, but really like that they get it, as they should. No one should give up their health care plan. People should get it. There was even a member of the New York delegation, when asked about it, was asked, are you going to take the government health care plan since you campaigned so hard against it? And he said, of course. What happens if I have an accident and I need health care? Where am I going to get it? Exactly. The same is true for a citizen who works hard. And by the way, of the uninsured, 75% of them have full-time jobs. It's not like they're slacking. They're hardworking Americans. And so the health care plan that we provided, like members of Congress, their staffs, and 9 million federal employees have, says, you know what, the more of us are covered, the more we can control costs, just like what the health care plan does. And here it is. The moment has arrived in the bill, and the silence is deafening. You could probably save a few shekels doing that. Couldn't you, Mr. Honda? You could probably save a few dollars if you eliminated that. Maybe this is the time to do it, and instead we're going to hear about an amendment. And Mr. Whitfield may be right. I don't know. I'll have to figure out how to vote on that. I'm not up on the coal-powered plants here. But it's certainly that opportunity. I would hope all of those people who deride government-funded, government-run health care can come down here. And while you're at it, I guess you're going to defund Medicare. I read that in the paper today. That's the next thing. Government-run health care. Well, this is kind of your moment to do it. Be consistent. Be honest. What this is really about is that we took a plan that is basically founded on free market principles and said, you know what? The employer-based model, we're going to try to have more people get employer-based insurance. But if you're really honest and consistent, this is the moment in the bill that I would hope my Republican colleagues come down 5 minutes at a time and say, let's get rid of that dastardly Federal Employees Health Benefit Plan that the legislative branch benefits from. Or at least come down and say, I'm taking it, and here's why I'm contradicting what I said in the campaign. This is our moment to do it, and I would hope we would.
Time has expired.